Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back. This is Dr. Thomas Grove on Living Pain-Free educational program. We're talking to you guys today about your musculoskeletal orthopedic needs, maybe how regenerative medicine using the power of platelet-rich plasma and stem cells maybe can address your issues and hopefully avoid an unnecessary elective orthopedic surgery. So I see Bridget here. Give me one moment here for that caller. I'm going to give out that number. We can get some more callers in. Number to talk to us live here in the studio, guys. We're at 866-870-5752. That's 866-870-5752. And if you give us a call, we're going to send you a copy of our book for free, even pay the postage for you. That's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you're ready for a free consultation over the phone with our staff, that number to call is 800-300-9300. That's 800-300-9300. If you want to check out our website, there's a spot on every page for you guys to send us an email. While you're there, check out some educational content, videos of us doing these procedures. We're at www.jointrehab.com. That's www.jointrehab.com. Bridget, thank you so much for staying patient with us. What can we help you with today?
I got in a car accident about a year ago, and I'm just starting to have neck pain. Doctors haven't been able to diagnose it yet. I did an MRI, and there's not really anything showing. But it's really hard to explain to a doctor that I have this pain from, I'm assuming, the car accident. I think I got some whiplash. And so I was wondering about coming in and maybe seeing what you could see through an ultrasound, because the MRI is not really showing much.
I'm sorry you're going through this. So for the car accident, after you had that initial injury, is it more pain? Is it more stiffness? Do you have any numbness or tingling going on in the fingers, anything like that?
More numbness. No, not as much. It's more pain and stiffness in the neck. Maybe some numbness if I lay on it wrong, if I'm laying down wrong, or maybe sitting for too long.
Okay.
So I'm not really sure about the numbness, but definitely stiffness and pain is developing more and more every day.
Yeah, not unusual. So a lot of times when we have these, high-speed mechanism sort of injuries, and we see a lot of folks that have had car accidents and had a lot of lingering issues, that's probably one of the more common, causes of chronic pain that we see. And again, it's the importance of taking a good, proper history during an initial consultation. We got to figure out exactly, what caused this sorts of things. But, you might have some nerve issues that get irritated. That's where you have maybe some numbness, tingling. Some people have some weakness. And if those things go away and you still have more, localized, stiffness or pain, very high chance there's something that we might be able to do for you. The really important factor here, Bridget, is going to be that physical exam where we can determine, what areas of your neck are bothering you. There's so many structures in terms of anatomy that could be causing that. Statistically, we see a lot of ligament strains. So a ligament is what attaches a bone to a bone. Have you ever sprained your ankle before?
Oh, yeah.
Yeah,
absolutely.
So we have
just walking.
We have the exact same sorts of tissues that help support the backbones themselves, and especially in the neck and the whiplash injuries, where that cervical or neck bones connect to the base of the head. Really extreme examples of that are something called craniocervical instability. Again, this is basically just saying, hey, we stretched out some of these supportive structures, around the spine. We can get a lot of lingering issues. We get folks who have, chronic headaches, migraines. Maybe there's some interesting sensations going across the forehead, into the ear, the jaw. Obviously, the base of the head is a very common area for that. Actually had some interesting cases here this week, all from car accidents. They all had different, anatomic structures that were actually causing their pain. One of which was something called the SCM, or the sternocleidomastoid muscle. It kind of attaches right behind the ear, goes down the front where the sternum is, where the clavicle or the collarbone is. So these are all, examples of, muscles that help support, the neck on the head. But the big idea is we got to figure out exactly where your symptoms are coming from. There's a lot of ligaments, tendons, and muscles in that neck area. And this is another one that, can be very, very dangerous to inject if you don't have the training in it. If you're listening to the show, you know how much I like using ultrasound. So especially in that neck, there's a lot of stuff, in a pretty small area that you don't want to be hitting with a needle, namely the spinal cord, right? Nerves, blood vessels like arteries and veins. And so those are all things that we can actually look at while we're doing that initial diagnostic scan. And then if you decide to have treatment, that's what I use to help actually guide the needle into these structures so we can be safe and be effective and use small needles to make you the most comfortable that we can. But yeah, the big thing is here, Bridget, got to get you into the clinic and get a good hands-on physical exam. Does all that make sense?
Is it normal? Is it normal to not really be able to see anything in MRI? I mean, because I'm seeing a spine doctor, and I did the whole MRI thing. I mean, he's just not seeing anything. So I just want to know, is that normal? And he talked about maybe possibly scheduling a surgery just to explore. And I didn't love that word when he said explore. Like, where is he exploring? Down my spine?
Yeah.
So
those are very good questions to ask. Yes. Yeah, so when we're looking at the spine, or any body part that we talked about in the front end of the show here, again, the imaging tells one story, but your body is going to tell another, right? That's going to be where that physical exam comes in, and where we have to evaluate, the body part dynamically. It's a very, very dangerous game to play when we're creating a care plan strictly based off of what that MRI says. And, you're a classic example where, you don't have a whole lot of pathology on that MRI report, but you still have symptoms. So, what gives about that? Very, very common that if you have a stretched out ligament, that you're not going to have that be pointed out on an MRI. Now, if you have a stretched out ligament, that's something that can be very, very debilitating. I actually experienced this myself, more in my lower back, and something called the iliolumbar ligament. It was like a pretty nagging injury I had from my days playing college football. But this is something that had nothing to do with the disc, right? So we get really excited about things like disc bulges or herniations in the spine, because that leads to things like spine surgery with fusions or maybe laminectomies, right? These are all pretty invasive procedures that we want to really avoid at all costs if we can, especially if we're not finding anything that's correlating on the imaging report. That, to me, is just a very sort of slippery slope to go down. Again, yeah, when people say exploratory, my question is, well, what are we looking for, right? Are we doing surgery just because we can? Or is there like a specific reason that we're looking for something that lines up with what the clinical picture is, right? So for me, that's a really bad idea. When you're looking at spine surgery, complication rates are a little bit higher. It's just the nature of that anatomy. Hitting a blood vessel or hitting a nerve in an area. You're looking at, hematomas or bleeds, which can cause blood clots and strokes. If you have an infection in an area like that, they can be very challenging to get under control when you're looking at things like, bone infections or spinal cord infections. So it's a pretty tricky area that you don't want to be exploring surgically, certainly. So for me, that's a pretty poor idea. But I would take some serious pause here, Bridget, before we do an exploratory surgery on a neck.
That's exactly why I called. I think it's very strange that just based off the MRI with no pinpoint of what's going on, we're just going to open me up and do surgery. And so I just think it's wild. That's all I was told to do by my doctor is to get an MRI. I wasn't told to do any type of how do you see our body again? What do you use?
I use ultrasound. So it's kind of the same thing. If you ever had kids and you do your ultrasound checks, it's the same sort of technology. It's just the equipment's more geared for the musculoskeletal system. So it's very, very high definition. You get a better picture than an MRI. Plus it's dynamic, right? So we can actually move you around. We can move the camera around with that ultrasound. It gives us a much better sense of what the soft tissue looks like.
I just wonder why my doctor didn't use an ultrasound that you're calling an ultrasound, right? I don't know why my doctor hasn't used it, because now I'm booking more appointments trying to figure this out. I kind of wish it was just a one stop. You go see your doctor and they kind of look at everything, but I guess they don't, So I'm gonna have to book an appointment with you.
Yeah, it's a really, really common point. Again, I can't speak for anybody else, but I can just tell you it's a lot of training. Again, ultrasound, just recently got pretty good here in the last 10 or 15 years or so, where The definition is so high. The issue is you got to get training on it, right? So if you don't have the training in it, you're probably not going to utilize it at all. And then if people understand how important it is, again, just the convenience factor. So if you go to a physician, you go to urgent care or something, orthopedic clinic, and then they order the imaging, many times it takes a long time to actually get the image done and read. And so for me, I took the long way with my training to make sure I'm trained myself. That way I don't have to send you out. We can do everything right here in-house, which just makes the whole process much more convenient for the patient. And the bottom line is, we get answers quicker, right? I don't want people waiting months and months to get some pain relief. So I wanted to be able to do all that, in one sitting and figure out exactly what's going on.
What you can see in real time, like if I'm in the office, you'd be able to kind of see what's going on.
Exactly. Yep. So it's kind of fun because the screen is actually right in front of both of us. So as we scan that body part, I kind of explain, what your anatomy looks like, what looks normal, what does not look normal, and correlate that with where your pain's coming from. So it's, again, I call it magic. I remember the first time looking at my own body with ultrasound, I'm like, oh, this is so cool. You can actually see your own anatomy. Because many times if you've had, like your MRI, you don't really get to look at it yourself. You're just kind of trusting the radiologist to tell you what's going on. But with ultrasound, it's live. I can do it right there in the clinic, and we look at your tissue together on the screen. So it's a pretty fun time to see exactly, where someone's symptoms are coming from.
Well, thank you so much, Dr. Grove. I'll call and book an appointment, so I'll see you soon.
Excellent. Thank you so much, Bridget, for your call.
All right. Bye.
Bye-bye. So we got a couple more minutes here, guys, left in the back end of the show here. Again, this is Living Pain-Free. I'm Dr. Thomas Grove. We're talking about your musculoskeletal orthopedic injuries and maybe how regenerative medicine using PRP or stem cells can get you healed up and keep you out of an operating room and avoid an unnecessary elective orthopedic surgery. So let me give it that phone number again here, guys. We get some more callers in. You can talk to me live here in the studio. We're at 866-870-5752. That's 866-870-5752. And if you give us a call, we're going to send you a copy of our book for free, even pay the postage for you. That's Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And if you want to get a free consultation over the phone with our staff for free, they're waiting by the line right now. That number to call is 800-300-9300. That's 800-300-9300. If you want to check out some videos of us doing these procedures, check out hundreds of pages of educational content. Check out our website. Great place to start to learn about regenerative medicine. Lots of good articles on musculoskeletal topics. Our website is www.jointrehab.com. That's www.jointrehab.com. So we got another caller coming in here. We got John calling to us from North Hollywood. John, how are you?
Oh, pretty good there, Doctor. The question is knees. All of a sudden, you turn to a certain age, it looks like you turn on the switch, and it says destruct. Anyhow, both knees, they claim, I have Kaiser, we did only x-rays, but they say it's arthritic condition in both knees. Is there any hope to help anything like that? I'm not going to get a knee replacement, that's for darn sure.
Yeah, so again, Johnny, this is a perfect scenario that if you're like really, against having the surgery, I think it really is a smart idea to look at all available options, right? Again, just to be totally transparent, I haven't seen anything that comes close to, preventing a surgery, halting the progression of arthritis in terms of symptoms than regenerative medicine. So do you have a good range of motion, John? Like, are you able to bend your knee a little bit?
Yeah, I can. Yeah, we can do that. Actually, I climb ladders and work, and you wouldn't even want to know my age. Maybe the best thing that happened to me is I'd fall off the ladder. We don't have to worry about anything anymore.
We want to prevent that. Yeah, so John, if you're a pretty functional guy, you're climbing ladders, for me to just guess, I'm guessing you're not truly bone on bone, arthritis, and there's no hope. Those are kind of the scenarios that if you have, truly no cartilage, typically you have a hard time with weight bearing. You're definitely not climbing ladders with it. And those sorts of folks, regenerative medicine can be very limiting in terms of what we're able to do with it. I've had a handful of patients in my career that we've had some symptomatic improvement that are truly bone on bone. But those are scenarios that you definitely want to, take a look to see what the surgical options are. But if you're that functional, I very much doubt that you're truly bone on bone. Every single...
I don't think I am.
Yeah.
But anyhow, is there any hope if it is arthritic condition? Is there anything we can do?
Yeah, so joint arthritis, specifically the knees, is probably the most common thing.
Really?
That comes into our clinic. Yeah, yep. But again, the very important factor here, John, that we talked about in the front end of the program is really getting a good detailed physical exam. So many times when that knee, even if you have some arthritis, a lot of times you're going to put some stress on maybe the collateral ligaments, right? Maybe you have some muscle issues, right? The calf muscles, the quad muscles, hamstring muscles. There's a couple other muscles that run through the middle of the knee. One's called the popliteus. There's a lot of different things around the joint that can certainly cause pain and discomfort for folks. It's not always just the joint. So many times it's the joint and something else. And the way that we tease that out, again, is a good physical exam and make sure we're getting you a good thorough scan with that ultrasound. So I'd love to get you in the clinic here, John, to take a look at you.
Okay, well, I've been there before, and I don't need a book because I already have one.
Oh, perfect.
So no sense in mailing me another book.
Yeah.
And I will make an appointment, and we'll at least maybe you can use your ultrasound and see what's crapped out there.
Yeah, absolutely. Love to get you some help, John.
All right.
Excellent.
Very good. Thanks for talking. All right.
Of course.
Bye-bye.
And John, we're going to keep you on the line here. Our radio guys are going to have a chat with you. But yeah, great idea here, guys, to talk about, how functional a body part is. So if you're looking at, doing a full-on joint replacement, you have to understand it's going to be the element of pain that's going to determine, hey, are we ready for that joint replacement? So, if you're truly end stage, cartilage is totally worn off, you're having a ton of crunching and catching, range of motion super limited, you have trouble with weight bearing, that's the type of patient we want to think about having a joint replacement. But many, many times, guys, especially if we get to things a little bit more on the front end of the progression of arthritis, we get a really good success rate with getting some folks decreased pain, increased function. Like we talked about with John, very, very important that we figure out if there's anything else on the outside of the knee joint, next to the knee joint, that maybe could also be causing some symptoms for somebody, right? So if we're skipping over those sorts of things, the pain continues, that could be something that leads to an unnecessary joint replacement. Again, we see this, sometimes every single day during my clinic week is going to be somebody who had an unnecessary surgery. You do a physical exam within a couple of moments, you can tease out exactly where someone's symptoms are coming from. And many times that surgery just did not address, the pain generator, right? So you got to be very careful. Anytime anyone shows me an MRI or a CT or an X-ray, I never get too excited, right? It's like, hey, listen, that's great. We've got some pathology. Could that be where your pain's coming from? Yeah, maybe. But you have to understand many times people have that pathology, right? That's the stuff that's on your radiology report, but they have no symptoms whatsoever, right? So we look at things like, joint arthritis or meniscus tears in the knee, labrum tears in the hip. A lot of folks are walking around with these sort of pathologies with no pain whatsoever. So it's our job to really tease out exactly where someone's symptoms are coming from. And then from there, we have, enough information to put together a good care plan, right? So I don't want to just make a care plan strictly based off of imaging, because you're going to miss some diagnoses, man. You're going to miss the true cause of somebody's symptoms. And when that happens and you're guessing, that leads to unnecessary surgery, which is the big thing we're trying to avoid, right? There's certain parts of the body that have a really good ability to heal themselves. If someone has a little muscle strain, something like that, within a couple of days, that might heal up on its own. But a lot of these sorts of issues that we see, stretched out ligaments or tendons, maybe little tears in those structures. Maybe you have some inflammation in a joint causing a joint sprain. Maybe you have some arthritis. These are all very common areas that just have a weaker blood supply. They don't tend to heal up very well on their own. And again, what we're doing, we're just using your body's own stuff, right? Using your body's own healing cells, concentrate those cells down using platelet-rich plasma and stem cells. And we're just, delivering these cells into areas that, have a, less than optimal blood supply. And it's no surprise that, a lot of folks get a symptomatic improvement, right? We're bringing in the raw materials to help that healing process. But the big idea is, figuring out where someone's symptoms coming from before we, put together a proper care plan, right? So those are very, very important factors to think about when you're trying to figure out, okay, what's the next step that I want to go for, right? And I know it can be a frustrating situation if you're kind of going back and forth with pain medications, anti-inflammatories, again, the steroid shots we talked about in the front half here in the segment, but really bad idea for wound healing. If we have injuries and you put steroids on it, you're literally, limiting your body's own ability to heal. Especially repeated injections, we know can actually degrade some of that tissue. So things like, tendons are more likely to tear with subsequent injections. If we're looking at things like arthritis, you actually wear down the cartilage faster using steroids. So not a great idea. It can provide some temporary symptomatic relief, but when that pain inevitably comes back, typically it's much worse than when you started using, injection therapy with steroids. So it's not a great option in our book. It's one of those things that's a Band-Aid that causes more harm over time. So what we'd rather do is give you the opportunity to heal up that tissue on your own, using your body's own healing cells, and hopefully avoid an unnecessary surgery. So those are great talking points there, guys. But yeah, just to finish up the show here, I got a couple of notes that I had reading some scientific papers here this week. They were looking at PRP versus steroid shots. And, it's a bit of a head scratcher that some of these studies actually get published because there's so many glaringly wrong aspects of a study. So there's some studies saying that, we couldn't really tell a big difference between PRP and steroids. And one of the biggest factors is they only looked at about 3 months out from the initial treatment. If you guys are listeners to the show, you know that, regenerative medicine doesn't just work for 3 months, right? We see a lot of healing that happens past the 3-month mark. So that's just, too short of a timeline to really observe patients for a study like that. And again, there's another study that came out here recently where they did not use ultrasound, which is a huge pet peeve of mine. If you're doing regenerative medicine and you don't have training in ultrasound, you're going to get less results than someone who has proper training in it. When you're looking at, joint spaces, very, very important that you get your cells directly on target in that joint. There's some studies between, 20, 40%, sometimes more, where if people think they're in the joint space, they're not, right? So if you're talking about, that's a huge chunk of patients now, where you're just not simply getting the PRP or stem cells directly where it needs to go. So using ultrasound is very, very important to increase the accuracy of where you deliver the cells, which then directly correlates into having better results, obviously, right? So that's a big one. Another one too, guys, if you're not using ultrasound and you're injecting into joints, many times you're going to miss what we call a joint effusion. So that's where we have an excess amount of joint fluid within the joint. So a couple of big reasons for that. So if I were to, let's say I got it into the joint and there's a big joint effusion, what we have is a watered down treatment, right? So what we want to do is get that joint fluid off, right? We do something called a joint aspiration before treatment. Because that's something that's going to be very important in terms of how efficacious these cells can be, right? So if I put it into a watered down environment, many times you're not going to get near the results had you had a proper aspiration before that treatment. And many times if you're not looking for it, you're just not going to find it, right? So that's a very important factor that I like to throw that ultrasound on to take a look at that tissue before we consider any sort of treatment, make sure that we're not missing anything. And a joint effusion is a big one. So especially when you're looking at, joint pain studies, whether it's the shoulder, the knee, or the hip, or the ankle, you got to make sure that if there's an aspiration there that we're getting that fluid off before the treatment. Many times too, that joint fluid is going to have, a suboptimal healing environment. It's got a lot of these, these bad guys of arthritis. These are the, inflammatory proteins and cytokines that lead to a more, degradative sort of internal environment of a joint. That's really where the big power of regenerative medicine comes in, is when we treat it, we actually create a more healthy internal environment, which is probably why we get such good long-lasting results with this. So a couple of good big points there when you're reading studies. You got to look a little deeper sometimes. That's the end of our segment here, guys. This is Dr. Thomas Grove on Living Pain-Free. Thank you guys so much for joining in with us here today. If you want to get a consultation with our staff over the phone for free, give us a call. We're at 800-300-9300 and check out our website, www.jointrehab.com. See you next week.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.